House Republican leaders scrounged votes Thursday to pass their re-reconfigured Obamacare replacement plan. But they're not there yet. And insiders say a vote this week looks increasingly unlikely. Multiple senior House Republican sources said Speaker Paul Ryan and his top lieutenants are making progress and are increasingly confident they'll eventually garner enough support to muscle the bill through the chamber. They've locked down the most recalcitrant conservatives in the 238-member House GOP conference. And they're slowly but surely picking off some moderate Republicans wary of a constituent backlash if they support the health care overhaul. But GOP leaders still have their work cut out for them. In recent days, about a dozen lawmakers, most who opposed the original draft that Ryan yanked from the floor last month, made clear their opposition to the latest version of the legislation. What's more, several centrist Republicans who backed earlier versions of the proposal, including Reps. Mike Kaufman, Arkelo, and Adam Kinzinger, are now undecided on the current plan. Plus, a small number of staunch conservatives are holding their ground against the latest plan despite Wednesday's endorsement of it by the conservative House Freedom Caucus. They include Reps. Andy Biggs, do.As, and Paul Gosar, do.As, oppose the bill. Ryan and his leadership team needs 216 votes, a bare majority in the current 431-member House. No Democrats are expected to support the measure, which would gut some of Obamacare's central consumer protections, repeals its taxes and phase out its massive expansion of Medicaid. That means Ryan can afford to lose no more than 22 Republican votes to pass the bill. House leaders and White House officials have struggled the past few weeks to strike a balance. Can keeps conservatives and moderates on board. A handful of conservatives say the measure still doesn't go far enough to do away with Obamacare, while some moderates say it will leave consumers with insufficient protections and drive up premiums for older consumers. The Congressional Budget Office estimated 24 million more people could go uninsured over the next 10 years under the original bill. The CBO, however, will not release the latest score on the new draft for a few weeks, congressional sources said Thursday. House leaders spent Wednesday buttonholing members, attempting to round up every vote possible. House vote counters such as Deputy Whip Rep. Patrick McHenry, RNC, were seen roaming the House chamber, corralling members who opposed the health care measure, including even Rep. Justin Amash, RMIC, one of the most ardent opponents of earlier versions of the health care plan. Amash, a Freedom Caucus member, has told reporters he's still reviewing the bill despite the Freedom Caucus endorsement. Vice President Mike Pence also trekked to Capitol Hill to meet with the moderate GOP Tuesday group, though the meeting did not appear to yield any new votes for the measure. GOP leaders huddled late into the evening on Wednesday, under heavy pressure from the White House to schedule a vote this week, and even held open the possibility of a weekend vote. Whipping continued into Thursday, but by noon, insiders said the votes still weren't there. Some mainstream and moderate Republicans stood. The White House has rewarded what they see as bad behavior by the Freedom Caucus, after trying to work in good faith with leadership. The skeptics said they are now being pressured to vote for a more conservative bill. Rep. Charlie Dent, ARPA, a company chairman of the Tuesday group, has been particularly frustrated by what he argues is a flawed process led to the latest proposal. He said it appeared to be more about Freedom Caucus conservatives, who came under fire, sinking the last version of the health care bill attempting to shift blame toward moderates. Ryan and his top lieutenants tried to pick up additional votes late Wednesday by releasing a new bill. Would remove an exemption for lawmakers and staff from potential cuts to health care benefits. The exemption, contained in the revised Obamacare replacement plan, threatened to unravel a delicate accord between the arch-conservative Freedom Caucus and a key moderate, Rep. Tom MacArthur, RNJ, as they work to lock down just enough votes to pass the measure. At the heart of the revised health care measure are the changes negotiated by Freedom Caucus Chairman Mark Meadows, RNC, and MacArthur, a second-term lawmaker and company chair of the moderate Gop Tuesday group. Under the proposal, states would be permitted to waive some of Obamacare's minimum coverage requirements and consumer protections, so long as they certified that they could offer an alternative that reduces premiums, enhances competition, or increases the number of people with coverage. Though the measure would preserve Obamacare's guarantee of coverage, people with pre-existing conditions, it also allows states to relax the prohibition on insurers jacking up premiums for sick people. To offset that risk, the bill includes a $130 billion fund meant to help keep premiums down. People with pre-existing conditions. But advocates like the AARP and doctors groups worry that it isn't enough.